Hello. I may not be seeing well, but I'm looking good. And that's what counts, right? My name is Christopher Bailey. I'm with the World Health Organization, and I would like to thank you for coming to our evening of People Who Care, two short plays on universal health coverage. Now, for me, this evening represents a particularly special event because it's a gathering of two distantly related clans, of which I'm a member of both. The clan of performers and the clan of healers. Now, I would like to address a few words to each of the clans individually. First, to the performers. You may not know much about public health, so let me just briefly describe to you what it is. Public health is not just about the doctor-patient relationship. It can be, but it's also about the air we breathe. It's about the food we eat. It's about being born in a safe environment. It's about dying with dignity. It's about responding to a collective health problem, an epidemic or an environmental crisis. But most of all, it is about ensuring that all of us have access to affordable, quality health care. And not for the rich or for the entitled, but to everyone because it is a fundamental human right. Now that shouldn't be controversial. It's in the 1947 WHO Constitution, so but some days it is, so that's fine. Now, this evening's performance is done today at this particular time to usher in the UN General Assembly that's coming up next week and the high-level meeting where a declaration on universal health coverage is going to be drafted and hopefully agreed upon. Now for the healers, you may be thinking, why theater? Has WHO gone mad? So to answer that question, I'm going to tell a little story. My sons love Greek myths. And a number of years ago, when they were small, we had a family vacation to Greece where we visited some of the archaeological sites of ancient Greece. And in the evenings, in the hotel rooms, we would pick roles and we would read the Greek myths aloud so that the next day, we wouldn't see just a pile of rocks. We would see Delphi, where Oedipus was warned that that woman looked very familiar. And that man you're so angry at, you better think twice about it because there are a lot of similar behaviors to you. And he did it anyway. Now, being an old theater person, one of my favorite things to do in Greece was to go to the ancient Greek theaters where I would practice my classical monologues in front of the tourists, much to the embarrassment of my sons. And I noticed that next to the ancient Greek theaters, inevitably, would be an ancient Greek hospital. Why? So I did a little bit of research, and it turns out that the ancient Greek conception of health was that in the morning, you would go to the hospital, the temple of Asclepius, and you would bathe in the waters of Hygienia to purge your body. And then you would go in the afternoon across the road to the temple of Dionysus, the theater, and purge your soul. And they saw theater and health as two sides of the same coin, body and soul. Theater, in the etymology, means a place to behold. This space around me is a place of revelation, of resurrection, and of redemption, where for an hour or two, together you and the players can share experiences and emotion and create a sense of community, where through that emotion, we might get a better sense of our relationship to the world, to each other, and to ourselves. So in the next week, those of you who are participating in the UN General Assembly, when you see a PowerPoint, when you see a graph, when you see some policy recommendations or technical discussions, I hope that you reflect on some of the emotions and experiences that you went through tonight together, and that you remember that populations are comprised of people, and in health in particular, people who care. Enjoy the show.